If you're a Black person in Canada, you might be wondering, what do we actually know about our health? What conditions are affecting us? And more importantly, what can we do about them? My name is Dr. O, and I'm here to tell you about 5 important issues that every Canadian should know about Black health. Unlike in the United States, we do not have a lot of race-based data to tell us about health disparities. But in recent years, due to advocacy and collaboration with allies and organizations, we do have some important data. So in particular in the areas of maternal health, breast cancer, and mental health. When it comes to breast cancer, we know that for Black women in Canada, they are more likely to be diagnosed with more severe or aggressive forms of breast cancer, like triple-negative breast cancer, but unfortunately are also more likely to be diagnosed later in their disease. Canadian research has also shown that Black mothers are more likely to experience complications from pregnancy and childbirth. This is a pattern that we've seen in other countries internationally. There's also a significant amount of research to show that in Canada, mental health is overlooked when it comes to Black communities. However, Black people are at higher risk of stress-related illnesses, conditions like psychosis and depression, and this is often linked to living with the reality of anti-Black racism. Thanks to the phenomenal work of Canadian researchers, we know that chronic diseases like high blood pressure and diabetes disproportionately impact Black Canadians. And in particular, we know that these are linked to, diet, lifestyle, and exercise, but we also know from international studies that these conditions are worsened or could even be caused by the stress of everyday racism. And unfortunately, it shouldn't come by surprise that we are disproportionately impacted by HIV and AIDS. Certainly for Black communities and for sub-Saharan Africa as a whole and the Caribbean, this has deeply impacted our communities. But in the context of Canada, the spread of HIV can actually be addressed by having better access to culturally safe and affirmative care, and for people having access to treatment on time. Although we have universal health care in Canada, these can still be barriers for our community. Cancer and mental health conditions also fall into this category where there's been a huge amount of research, but I mentioned that earlier. Simply to say that when it comes to cancer, we know disproportionately impacting Black communities are breast cancer and prostate cancer. And when it comes to mental health, as mentioned earlier, there's a growing body of literature to show that living the everyday stress of racism can have an impact on mental health, particularly for the children of immigrants. So people who are in the next generation born here, it looks like it has a disproportionate impact. There is one genetic disease that I'd like to mention, or genetic condition, and it's called sickle cell disease. We see sickle cell disease or sickle cell anemia in different parts of the world, but in particular in West and Central Africa. And those are the areas where people came from during the transatlantic slave trade. So we see folks with that ancestry in the Caribbean, in South America, in North America, including Canada. And I think the biggest thing to recognize with that is that it can cause a number of health conditions, from chronic pain to stroke to immunocompromise. But one thing that we see in communities that experience sickle cell, or for patients that experience sickle cell, is being stereotyped. And so one of the actual challenges that we have is not so much the genetic condition, but it's access to anti-racist, culturally safe care where people can be believed when they're experiencing pain. One thing that we need to work on in Canada in our healthcare system is believing Black patients when they say they're in pain. The good news is that in Canada, Black communities and allies are looking for solutions. And so there are really great things that are happening at the system or community level, as well as things that we can do at the individual level to stay healthy. So at the community and system level, in the province of Ontario, there is a Black Health Plan, and you can even look it up. It came out after the pandemic and talks about how the system could improve, but in particular has key recommendations on how race-based data should be collected, on how Black communities and community leaders should be engaged, and in particular recommendations on how to provide culturally affirming care to Black patients across the province. This is a really great step for the province of Ontario, but definitely we'd like to see the other provinces step it up and have their own. And of course, we need to take our own health into our own hands. And so there's a number of things that we can do to stay healthier. These are things that you've heard before. Of course, making sure you get enough sleep, making sure you eat well and exercise. Meditation is always important, and making sure that you see your family doctor or nurse practitioner or some form of primary care provider to have your regular checkups. But I think when it comes to overall health as Black people, there are those kinds of like standard everyday advice, but the difference between us and the rest of society is not actually our biology or our genetics. It is the experience of anti-Black racism, which is a form of stress because it involves maybe being denied opportunities or being the only in the classroom, in the boardroom, in different places and spaces. And that can increase stress levels. And so it's actually really important to be intentional about stress management. And sometimes I think it's actually even more important to find ways of addressing your stress that come from our different cultures around the African diaspora. So that might be gathering in different ways, that might be celebrating in different ways, finding ways to find Black joy that speak to you, right? So is that carnival? Is that, just laughing on the phone with somebody who's going through something similar to you? Is that taking time to pray and meditate in a way that is Afrocentric or speaks to you? It really depends on the person, but there's that saying, I think Erykah Badu in her song says, pick your friends like you pick your fruit. Well, pick your habits, your coping mechanisms, your ways of finding joy like you pick your fruit. Is it quality? Does it work for you? Does it bring you joy? And I think those are the key things that we need to be intentional about, especially when we work or live in spaces where we're the only one or we're the extreme minority. It becomes really key to look for peers, to look for validation, and to find ways to be able to express ourselves. One key thing that I really want to share with you is a term. It's called self-determination. And what that is being able at an individual level or at a community level to set the agenda and speak up towards the thing that you want to achieve. And so for us, when it comes to health, self-determination is key. We need more Black doctors, we need more researchers, more Black healthcare providers and leaders across the board. And so that needs to happen. We also need better policies. Policies impact our health too. So having policymakers and advocating for policy changes that reflect our experiences is also key to improving our health. And then finally, it really does take a village. And so we need to be involved in being willing to advocate, being willing to donate to causes that advance Black health. And then finally, just being part of community. So taking part in the work that's being done around Black health that's being led by Black community health centers and other organizations and allies who are committed to providing dignified care for Black Canadians. And so we want to be part of that transformation, part of that innovation. And so I really do hope that you stay engaged and stay active in this work, because that's how we get better health. One way that I give back, aside from being a clinician, is I founded Healthcaring Differently, which is a form of digital mentorship. So I'm on social media providing mentorship and outreach to Black and other diverse students so that they can be exposed to the field of healthcare. I have interviews with my colleagues in research and nursing and medicine who are themselves different, and we are healthcaring differently. And the goal is really to provide inspiration and information to students so that they can get on the pathway towards mentorship, job opportunities, and scholarship. To learn more about Healthcaring Differently, check out healthcaringdifferently.com.